Hi, this is Jack Mackinson, and what I'm going to show you today is my emergency first aid kit, and it deals with a lot of items that I keep in my first aid kit. Now, the first thing I have is a bag that contains all the first aid supplies and medicine. This is called a Black Hawk. It runs about $28. And what I like about this particular bag is that when you open it up, you can see that all see-through compartments, so you can see all the things that you'll need without digging into a bag and pulling everything out. And there's a compartment for each type of first aid supply or trauma. I could do a little bit of trauma with it. Okay, the next thing I have is this is called a CAT. It's a combat application tourniquet to stop severe hemorrhaging on a leg or an arm. The next item is it's made by 3M. It's called transport tape, and it's breathable and it sticks very well. And the next thing I have is it's a portable eye wash station. And what's nice about this is it has a cup right onto the top that you can just put over the eye and tip your head back and blink and get any kind of particle or little bug or whatever you might have in there. Okay, you can't see this very good. These are called IFAK, and there's like waterproof Ziploc bags, and they're made out of Mylar instead of just plastic. So they're pretty well waterproof, and they work great in different sizes. Okay, the next item I have is 4x4, and this is a surgical grade gauze sponges, and it absorbs a lot of blood. Whoops, let me go back. Okay, the next item I have is a roll of bandage. It's called Curlix, and it's very absorbent, and it sticks to itself. And if you have a wound and you clean it out and put a bandage on it, you can wrap it with that. It's very soft. I have some angled tweezers for pulling out splinters and things like that. The next item is a CPR mask, and I use this particularly for people that I don't know or strangers, in case they might have an infectious disease or they might vomit, and I don't want to have anything to do with that. Okay, the next item is ammonia inhalants. They call them smelling salts, and someone that's passed out or fainted will bring them back to a level of consciousness. Another set of tweezers. Now these have strong points on them, and they're also used for splinters and things that are really small that you can't get with an angled tweezers. Of course, a magnifying glass to see those splinters. Then, of course, I have cold packs for sprains and things of that nature. I have burn spray. Some people get burns and it takes the sting out and it helps promote healing. The next thing is I have an assorted fabric. I like fabric over plastic because it breathes and it seems to stick better. And it has small, large, medium, and it has some knuckle bandages in there as well. This is called Neo to Go. It's Neosporin, and it's in a spray. And after I clean a wound, I'll spray that on there as an antibiotic. The next item is, this is a finger splint. It's made by Sam. And it's mainly for fingers that are sprained or dislocated. The next item is, these are gauze pads, but they're called Adaptic. They're non-adhering. That way you can put it over, clean a wound, and put this bandage on, and when you go to change the bandage, it won't rip the skin and the scab off. So I like that. Those are great. These are called Raven, and they're nitrile gloves. I always put these on first when I'm handling a patient or someone that's injured. The next item is called Tegaderm. Now, you're probably familiar with this. They use it in hospitals a lot. Once they put an IV in, they cover that with this bandage, and it's clear, and it sticks very well, and it's very flexible. And I can put that over like a 2x2 or a 3x3 gauze pad to keep it in place, and it breathes out, but nothing can get in. The next item is called Quick Clot. It's a clotting sponge. Now, this is different than a Quick Clot granules. I use the granules for small cuts on the fingers and things like that. It's a hemostatic agent that helps gel and stops the bleeding. The sponge, however, is used for larger wounds in the arm, legs, or abdomen, and it does not create clots that may go to the lungs or the heart and cause a stroke or something like that. Next item, everybody's familiar with this. These are steri strips, and they're put over wounds in lieu of staples or sutures. Here's another SAM splint, but this is a larger one. This is 36 inches. It can be used on an arm or leg. Super glue. It's great stuff. They found that this worked well when there was, I think it was the Vietnam War, to close wounds, and it works great. Good item. I get individual disposable packages for closing little gashes and stuff like that. Can't see this too well, but it's called compound benzoate tincture. Now, tincture means that it's sticky, and it also contains benzoin, which is an antiseptic. I can put that on a wound and then put like a Tegaderm over it for extra adhesiveness. And I have Provodone. It's like betadine. I use that along with alcohol swabs to it's an antiseptic for cleaning wounds. And of course, alcohol swabs. I use Fisker scissors. They're great. They're better than EMT shears. EMT shears are they bend, they can break, and they don't do well at all. So just plain old Fiskers can help me cut away clothing to get a wound. This stuff's called Coban. Coban is a self-adhering, like an ace bandage, except you don't need clips or Velcro. It sticks very well, and you can wrap a wound that's been gauze put on it. They use it in hospitals a lot. Okay, now these are big Surgipad. These, I think, 5x9 inch. These are for abdominal wounds, and I think they absorb like 5 times its weight, and they're great. They're a hospital grade. Here's a new high-tech bandage. They come in different sizes, but they're called Polymem. It's a new technology, and it's called Quadrafoam pads. And these, when placed on a wound, absorb 10 times its weight in blood. So those are great too. They're very expensive, but they're worth it. And that's it. So let me get out of here. And thanks for watching.